Achilles tendonitis is a common problem seen in offices of doctors who take care of foot and ankle problems. And Achilles tendonitis can occur in several locations, and I'll talk about those in just a minute. However, I think it's important for us to realize that the Achilles tendon is one of the most powerful and significant tendon and muscle combinations in the entire body. Achilles tendon requires about up to 12 times body strength or force, body weight or force when walking, and in some instances when running. Because of this, it takes on so much force every day, with sometimes over 10,000 steps per day, that tendon over time can start to break down because of overuse. We see overuse injuries in a lot of places. Sometimes wrist tendonitis is a similar kind of a thing. Anywhere where a tendon is being used again and again, that tendon is susceptible to injury. Now, the Achilles tendon has several features that are significant. First of all, the Achilles attaches to the back of the heel, and when the ankle rolls forward during walking, that tendon plays a significant part in pushing off and having that strength to be able to push forward. When running, and in particular with sports activities, the Achilles tendon sees a huge amount of force going through that tendon. The tendon has a couple of reasons for injury. One is the forces. The second is that the blood supply, which comes in below and from above, tends to be a little bit weak in the middle part of the tendon, and the tendon in that area cannot repair itself quite as quickly because the nutrition from blood doesn't get in there. And so what can happen is the tendon can break down in two areas. One of them can be in the middle part of the tendon, and you may feel a large bump right in that area, or it may start to become a painful lump right in the back of your Achilles. We call that mid-substance tendonitis or nodular tendonitis. And when it occurs in the heel, right where the tendon attaches to the bone, we call it insertional tendonitis. The insertional tendonitis is the most common of the two, and it's also the most difficult to treat. The first thing you can do at home, if you start to develop pain in the back of your heel, which is the most common symptom, and swelling can also occur as well, if you start to develop those symptoms, the first thing to do is to cease the activity that you feel has caused that to develop. If you've been recently increasing your running distance or the intensity of your sports activities, then you should certainly back off and slow down until the pain is resolved, or at least go to a level of activity that doesn't aggravate the pain. The second thing to do is to consider RICE, which we've discussed before, with rest, ice, compression, and elevation. All of these things can help to reduce the pain. Anti-inflammatories can help as well, and again, Motrin or Aleve or naproxen are good examples of medications that can help to reduce that pain. One of the things that can help at home that you can do before you see a physician for this, though, besides rest, would be to consider putting a lift in the heel of your shoe, or going to shoes that have about a 1/2 inch lift, because just tilting that foot forward like that will actually decrease some of the tension on the Achilles, and it'll also reduce the pressure that happens from the back of the bone pushing against the tendon, which is one of the reasons that this occurs. So going to a little bit of a heel lift over the course of several weeks can help this. If pain persists longer than about 2 months, then I think that's an appropriate time for you to seek treatment through your foot doctor. And most of what he'll probably recommend initially will be the use of a heel lift, and that can be added to the outside of your shoe or also to the inside of the shoe, or both. Second thing he might do is immobilize you or put you in a boot or cast for a period of time, and often it will be between 4 and 6 weeks. And then the third thing he might also consider might be the application of types of creams to the back of the heel that can decrease the inflammation. Physical therapy, however, is probably the most important thing he's going to recommend initially. And in both types of Achilles tendonitis, therapy can really reduce the symptoms and can heal this, at least reduce the pain that you've felt. And therapy will involve some strengthening exercises and some stretching exercises, as well as some various massage type techniques that they may use on your heel. After physical therapy, if you're still continuing to have pain and it lasts for up to 6 months of treatment, then it is often appropriate for surgical treatment. And surgery usually involves debridement, which is removal of some of the portion of the tendon that's diseased, and sometimes even taking a tendon from one of your toes and transferring it to the back of your heel to give extra strength to the Achilles to protect it. For the insertional style, where it's down next to the heel bone, or where it attaches to the heel bone, sometimes it requires removal of part of the bone, as well as occasionally detaching and reattaching the tendon. And so the surgery is a big surgery, and one that I would only consider doing, and most foot surgeons would only consider doing after really exhausting all of the possible non-operative treatments.